Then query number 12 from tier 2, City of India. Many times I feel great difficulty in explaining importance of treatment to patient. I should be able to explain it in such a way that they should feel importance and urgency of doing it. However, many times I fail in it. You are doing sales by default. Learn to do sales by design. Learn this is not your problem. This is a learnable skill. Make that as a learning goal to learn communication. Make that as a learning goal to learn how to sell. Selling is an art and underlies the need of understanding the patient's needs, exploring that by asking meaningful questions. Once you ask meaningful questions, you are able to uncover those needs a great deal. I have not incorporated informed consent in practice. I fear patients may take it negatively. If it is your fear, why don't you try it and get over this fear? Why don't you try it and get over this fear? I've already answered it in the recent question that consent is an extended communication due to which your form becomes a procedural formality only. It is a full science. Learn it properly. Don't just copy paste the form. Nothing beyond that. Though I have standard protocol for treatment payments by every patient, however, get stressed to explain same to friends, doctors, and colleagues whenever they have turned as patients. Never take leniency in any of the SOPs that you do in your practice for any known patients, especially. A rule is a rule and has to be followed. A policy is flexible and can be changed, which means your policy is, for example, that you take 50% advance. Now, that policy can be flexible for our friends, doctors, or colleagues. Can be taken later on. But for example, a rule is consent that has no exception. So learn to differentiate between a rule and a policy. You should be flexible with the policy, stringent with the rules.